You're watching CTOM TV. Knowledge is power.
So we're going to go over a few cases here of just some novel new things in a variety of different sarcomas. Now, there's so many different sarcomas, we couldn't really pick any one. We just wanted to cover a few different subtypes. So angiosarcoma, this is a difficult to treat cancer. Angiosarcomas can actually happen from a variety of things. They can happen from radiation. So they do happen in breast cancer patients who've had radiation, or they can also a certain type of angiosarcoma can get caused by breast implants, breast augmentation implants. I don't believe they use those implants anymore, but there's been cases of them causing angiosarcomas. And basically what an angiosarcoma is it's a sarcoma that occurs in the blood vessels, in the lining of the blood vessels. So one of the new treatments that is kind of interesting is using a combination of two of the immune therapy drugs that we talked about before. So studies have shown that in at least 25% of angiosarcomas, using these two drugs, PD-1 inhibitors and CTLA-4 inhibitors that are approved in other cancers, can be quite effective in 25% of angiosarcomas. But there's still 75% of angiosarcomas that these drugs don't work in. And that's where RNA sequencing is really important. So one of the interesting things about RNA sequencing that we use when we look at angiosarcomas is an accidental expression testing or an accidental discovery based on this messenger RNA sequencing expression testing was a discovery that a lot of these angiosarcomas have what's called high expression of the beta-adrenergic receptor. Now, this is something that's used, I believe it's involved in blood pressure, regulating blood pressure and so on. And there is a simple commonly prescribed drug that many people take. It's called Propranolol. It basically reduces this beta-adrenergic receptor expression. And so what they found is that a lot of these angiosarcomas had overexpression of this. And so some scientists said, well, why don't we give these patients this heart medication and see if it works? And when they did a small experimental study, they found that in the patients that had high expression of this beta-adrenergic receptor, when they gave them propranolol, almost 100% of patients responded with either stabilization of their disease or remission. So this is a very, very cheap drug that's easily available and can have a huge benefit. But you would never know if this drug is useful for you or not if you don't know if you have high expression of the beta-adrenergic receptor. So once again, RNA sequencing is very important for determining that. So if you have angiosarcoma, that's one of the first tests you should get.
Thank you for watching CTOM TV. Subscribe below and stay informed.